Welcome back. Major news on Pfizer and BioNTech's COVID-19 vaccine this morning. The companies announced they will submit emergency use authorization requests to the FDA today. Both are expecting to produce up to 50 million doses of their COVID vaccine globally in 2020 and up to 1.3 billion doses by the end of 2021. The companies say that the vaccine will be ready for distribution within hours after authorization. Joining me right now to talk more about that is U.S. Health and Human Services Secretary Alex Azar. Secretary, it's great to see you. Thanks so much for being here once again.
Great to be with you, Maria. Thanks for having me.
Your reaction to this news, it's amazing to me that they could actually be ready within hours of getting the emergency use. How soon could approval happen and the vaccine be administered?
Well, thanks to President Trump, hope and help are on the way. Tomorrow, we are literally 10 months from this plague hitting our shores, and today, Pfizer will be filing an emergency use authorization for a 95% effective vaccine, thanks to Operation Warp Speed support. Now, what will happen is we will announce an FDA advisory committee date. That's a public, transparent process that FDA will use. And assuming the data is as clean as it appears, and assuming there aren't any other hitches in the process, we could literally be looking at authorization of this vaccine within weeks. And as General Perna from the Defense Department and Operation Warp Speed has said, we will have shipments within 24 hours of millions of doses of this vaccine out to the American people to get it to the most vulnerable of our citizens.
So what are the challenges in terms of the distribution then, Secretary? Because I know that this involves a refrigeration mechanism. How many of us do you believe will have an opportunity to get access to this vaccine in short order?
So what we've said is we expect to have 40 million doses of the combination of Pfizer and Moderna vaccine by the end of December. So that would be enough to vaccinate 20 million people just in the month and a half that remains in this year. And as General Perna laid out last night at the Public Task Force White House briefing, the cold storage requirements on the Pfizer vaccine are not something to be afraid of. It is well managed. We have worked out over 6 months the operational plans with Pfizer, with our states, and with our major wholesale distributors and retail pharmacies. So this will not be an issue in getting this vaccine out there to the American people.
Let me ask you about the director of the FDA's Center for Biological Products, Dr. Peter Marks. He said it will take weeks for the FDA to review any vaccine application. He says he plans to run transparent process to build trust, but says that if the vetting process is not followed or rushed, he would resign from the agency. Alex, your reaction?
Well, Dr. Marks is a very fine official who's been, I can assure you, committed to the work of Operation Warp Speed, and I can assure you has a deep sense of commitment to the urgency of getting safe and effective vaccines to the American people. I will ensure that there's a transparent, independent process because I'm going to ensure that any vaccine is one that I would take. And frankly, Maria, I'm going to ask to take the vaccine as soon as anybody will let me, because I want to demonstrate to the American people my sincere confidence in the independence of the process and the quality of the data.
So what are the priorities in terms of who gets access first then, Secretary? Are you looking to make this available to those very vulnerable in our community, older seniors? Are you looking to get it to young people so that they can go out and about and keep our economy going? What's your thinking?
Yeah, so we'll be determining very soon our recommendations out to the governors of whom we think should be prioritized based on the data that we've seen for the Pfizer and Moderna vaccines. What will happen is there's an advisory committee at the CDC that will make a formal recommendation, but then the CDC director and I will make a final recommendation to the states. The groups we should be thinking about, though, are fairly obvious, which is our most vulnerable, those in nursing homes, assisted living, et cetera, as well as our healthcare workers and our first responders. Those are the cohorts that you should be most thinking about in terms of making sure we get the biggest bang for the buck with the initial millions of doses of vaccine that will be available.
Yes, thank God for our healthcare workers on the front lines, that's for sure. Look, I want to switch gears, ask you about the president's announcement of 2 new rules to lower drug prices in the United States. He's going to be speaking out about this later today. As you know, Secretary, one rule would limit rebates paid to middlemen in Medicare, while the other would push Medicare to lower drug prices linked to prices charged in other countries. Secretary Azar, what can we expect from this press conference, and how come the prices of our drugs are not linked to the competitive global backdrop right now?
Well, Maria, I'm not able to comment on what the president will be announcing connected to drug pricing. Just suffice it to say, it's going to be an important developments to bring down prices for Americans. You know, when I interviewed for this job with the president, his focus was on getting drug prices down. The first meeting I had with the president once I took office was coordinating a game plan on what we should do to get drug prices down. May of 2018, we rolled out our blueprint, and we've been marching through that, including the first ever authorization for the importation of safe and effective medicines into the United States. We are deeply committed to getting out-of-pockets down, getting list prices down, and ending foreign free riding, stopping American seniors from subsidizing socialist systems abroad. President Trump has the courage to take on these special interests. Nope, there's a reason. There's a reason these special interests haven't been taken on before. They are powerful. They fight back. But President Trump has the courage to actually take them on. Now, I'm not going to preempt him. I'll let him announce what he's going to announce this afternoon. But he's fighting for the American people and America's seniors, as you know.
You know, people who are sick have to deal with these prices that in some cases, you look at a cancer patient, it could cost tens of thousands of dollars a year just to get that medicine. Why has this been so expensive? I know it's the million-dollar question. We've been dealing with this for so long, and I know it was a campaign promise of President Trump to get these numbers down. But characterize how significant this is when you've got a cancer patient needing 1 round or 2 rounds of medicine costing them $50,000 in some cases.
Yeah, Maria, it can be life-threatening, and I guess what's particularly galling to me is the fact that America's seniors pay as much as 2 times what well-developed advanced health systems in Europe pay for the exact same medicine coming off of the exact same production lines. American patients are not getting the benefit of the $40 billion of rebates that drug companies pay to middlemen when they show up at the pharmacy, when, especially in January, when they're in their high deductible period of their health plans, they're paying sticker price while the middleman is getting a kickback, oftentimes over 30% on that drug. And so it's a real issue because the more somebody pays out of pocket, we know the less they will adhere to that medicine. And there's a reason you need to take these medicines to improve health outcomes.
Yes. Absolutely. Secretary, we'll be watching the president later today with these important announcements. We appreciate your time this morning, sir. Thank you.